I want to welcome everyone to part two of a hearing which we first held last month. During part one, I began by saying that vaccines are crucial tools for public health, which save millions of lives. I want to reiterate that today. However, the utility of vaccines is dependent on the American people's trust, like any other medication. Vaccines are only useful if people trust that they are safe and patients elect to get vaccinated. I've heard criticism that this committee is simply seeking to rehabilitate the image of federal agencies despite their shortcomings during the pandemic, and I disagree with that characterization. Rather, my goal is to reform these agencies so they can earn the people's trust. You know, it's easy to kick and scream about the federal government's failures. It's quite another to actually fix the problems so that we may do better the next time. That's really the goal. But this can't be done without buy-in from all parties involved, including from federal agencies. During part one, we heard from 3 of the federal government's experts on vaccine safety, surveillance, and compensation. We learned that the government was unprepared for this massive wave of reports to its surveillance systems and claims to its compensation programs. You don't expect a pandemic every day. It's understandable. Today, we will hear from non-governmental experts who utilize these systems from the other side, and it's important that the American people hear from the doctors who actually treat COVID patients. I've said that since the beginning of the pandemic. Unfortunately, during the pandemic, it seemed that the loudest voices were government bureaucrats and politicians. And I have found, as a physician and as a member of Congress, that Americans want to be educated, not indoctrinated. It's key to the doctor-patient relationship. So one doctor who was bedside during the pandemic is Dr. Patrick Whan. Dr. Whan is a pediatric rheumatologist and an expert in molecular biology and immunology. Now, Dr. Whan is a co-authored a paper which studied COVID-19 vaccine trial data and found excess risk of certain serious adverse events. Dr. Whan also submitted a VAERS report for a young child who experienced a cardiac event after a second COVID vaccination. Sadly, a week later, that young man, that boy, died. Dr. Whan tried to update the report. He discovered that the VAERS system is not set up to acknowledge updates such as this. VAERS still lists the outcome as cardiac arrest. Dr. David Gortler is a pharmacist and pharmacologist who has experience as an investigational medicine scientist at Pfizer, as a professor at Yale School of Medicine, and as a medical officer and senior medical analyst at the FDA. Dr. Gortler has submitted written testimony today, which indicates that the FDA's systems and procedures for assessing and regulating COVID-19 vaccines are inadequate. Among other things, Dr. Gortler argues that the U.S. MedWatch surveillance system, which includes VAERS, should be used more aggressively to warn patients about adverse events. We will also hear from an expert on vaccine injury compensation. As I stated at the last hearing, the government has assumed the responsibility to compensate for vaccine injuries, however rare they might be. Yet it appears the government system may not be properly upholding this responsibility, especially during a time of a pandemic. Appearing before us today is Ms. Renee Gentry. Ms. Gentry is the director of the George Washington University Vaccine Injury Litigation Clinic and has practiced as a vaccine injury attorney for more than 20 years. Ms. Gentry will testify regarding vaccine injury compensation program and countermeasures vaccine injury compensation program, which adjudicates claims for COVID-19 vaccines. In her written testimony, Ms. Gentry has highlighted serious problems with these systems, which require modernization. Ms. Gentry also explains that the CICP gives the vaccine injured little more than a right to file and lose. We can't be fully prepared for a future pandemic until we properly address the shortcomings in our vaccine safety systems and any other shortcomings that we may recognize so that we can correct them. I look forward to a robust and on-topic discussion today, and I would now like to recognize Ranking Member Ruiz for the purpose